Second, the guidance on the patient data also important to prevent the medication error and to ensure the medication safety. There's three factors associated with the computerized information system or patient data. The first one, difficult process to generate the first prescription, such as the default dose regime or miss alert. Second, might be due to the process of generating the correct repeated prescriptions, some of the lack in terms of the accuracy in the records, and also the inadequate design that might allow the human error. Previous studies have identified few strategies to prevent and reduce the medication error, such as the utilizations of technology, such as CPOE, CDSS, telemedication, smart infusion pump, and some of the signals or alert, and also using the reporting system and interventions of the healthcare provider. So basically, one of the strategy, which is the electronic prescribing or the computer aid prescribing and CPOE, is one of the technology or framework that permits the physician to write and sign the prescription electronically to the concerned pharmacy. These CPOE systems is provide a clear, readable, and complete order to decrease the prescribing and transcribing error. So this system, it can be integrated with the CDSS. This CDSS, they can suggest the drug dose, administration route, and some other suggestion that may also offer the drug safety features, such as checking for the allergies due to the drugs or any of the drug-drug interaction between the drugs. In a recent review article, it was found that CPOE with a CDSS, they can result in 36% to 87% reduction in prescribing error based on the study. Okay, and in another review by the Clean et al. 2012, it was observed that electronic prescribing and CDSS, they reduce the improper use of the drugs and polypharmacy. However, the unwanted consequences of this CPOE, they may include the new types of the works or burden and some of the error. Some of the study also been mentioning that the healthcare provider might be over dependence on this type of the technology. Okay, yeah. And the second one is the barcodes. It can reduce the medication error and improve the patient safety. Barcodes, they can include the strategy to identification number of the drugs, brand name, packaging size, expiry date of the drugs, and also the batch number. The FDA, they recommended the use of the barcodes in 2003, which came into the effect in 2006. BCMA, which is the barcode medication administrations, is an inventory control system used in the hospital with the goal to ensure that patients are receiving the correct medication at the right time. Based on the study conducted by the Hoffman 2008, not only in terms of the patient safety, but the implementations of the BCMA showed to save more than $2 million annually. Second strategy is the intervention by the pharmacist. In an educational intervention made in a Malaysian public hospital, the error-free prescriptions increased by 3.5% by the interventions of the pharmacist. In one of the study, which is Murray et al. 2009, it was found that the pharmacist intervention decreased the risk of ADE and medication error, especially in the outpatient department. And another study conducted by the Lee et al. 2003, almost all changes intervened by the pharmacist were accepted by the physician. The most common interventions, such as the changes of the dose or the order of the lab tests. Lastly, an effective medication error reporting systems, they provide an opportunity to find the cause of the ME. In the absence of such a system, the majority of the ME will go unnoticed. Okay, so in Malaysia, MERS, Medication Error Reporting System, is a national reporting system introduced by the Pharmaceutical Service Program, Ministry of Health, since 2009. So all the healthcare professionals, either from the government or private healthcare facilities, they are encouraged to report the medication error encountered. Okay. Encouraging the reports of the ME from the various of the healthcare professionals such as doctors, nurses, and pharmacists who are frequently involved in the medication process will allow a clearer picture of the actual medication error occurred. Thus, it will improve the approach to prevent the error that are potentially harmful or even will lead to the death.